A Medical Humanities Moment. A quick look at the myths, legends, and symbols of modern medicine. Even if you've never had a shave and a haircut at a grooming salon for men, in other words, a barbershop, you've certainly seen the commonplace symbol that appears outside many of these establishments, the barber's pole. Typically around 1/2 meter or 1.5 feet in length, these cylindrical signs feature a helix of red, white, and sometimes blue bands that twist up the column, and in some cases, actually rotate. There's usually a round globe or light at the top, and sometimes a thick base at the bottom. It's the universal barbershop symbol, telling passersby at a glance that this is the place for gents to get that new do. So, what does it have to do with medicine? Turns out, much more than you might think. The barber's pole symbol has been in common use since at least the Middle Ages, when barbers not only cut hair, they also performed surgery, set bones, bled or leeched patients, and extracted teeth as well. During that period, the pole featured brass wash basins, top and bottom, the top basin representing where leeches were kept, and the bottom representing the bowl into which blood was drained. One theory, as to its origin, states that the twisted strands around the pole are derived from the caduceus, the staff of the Greek god Hermes, now used to represent the medical profession in general. Another, more vivid theory, claims that the white and red stripes came from the practice of hanging bloodied bandage strips out to dry after being washed, which would dance and twist together in the wind. Given that washing used linens, instruments, or even your hands was unheard of in medical practice until the middle of the 19th century, this last theory seems a bit unlikely. It is likely, however, that the white of the bandage and the red of your draining blood inspired the barber's pole as we know it today in some way. The addition of a blue stripe is also up for debate, but the most prevalent theory ties it back to Renaissance Amsterdam, where the red, white, and blue stripes on the pole came to mean that the barber could bleed you, red, pull your teeth or set bones, white, or simply give you a shave. Medieval barbers were actually called barber surgeons, and although it's hard to imagine any medical art as a lowly practice aimed at the lowest classes of society, that's precisely how it was thought of then. The barber surgeons were the ones to actually practice medicine, unlike the physicians who merely studied it. After the Catholic Church banned clergy from performing surgery in the year 1210, a kind of elitism gradually divided those who studied the art of medicine from those who actually practiced it. A physician, expensive, high-ranking, and well-connected, understood the 4 humors of the body, for instance, and how an imbalance of the humors led to many physical diseases, or so they thought. A barber surgeon, cheap, illiterate, and very hands-on, was the one who wielded the blades and dealt with all the pain and blood and mess. This distinct division remained until 1540, when Henry VIII tried to unite the physicians with the barber surgeons into one establishment, the Barber Surgeons' Company. But this uneasy union only lasted until 1745, when the two factions went their disgruntled, separate ways again. And lest you think that medieval barbers were up to their elbows in blood and guts and spent little time haircutting, it's worth noting that what we consider typical barber services today were in high demand back then too. In spite of modern fiction and television, which tend to depict medieval men as bearded and often long-haired, for many centuries it was much more common for men to be clean-shaven and short-haired. The barber surgeon's largest clientele, however, were the monks and friars of the time, who were required to have a small circlet of hair shaved from the top of the head, called a tonsure, and therefore needed the trusty blade of a practiced barber. A bright red and white pole was just the thing to direct the holy brothers where to go. The barber's pole symbol is still with us today, of course, but not without controversy. In the U.S., barbers have gone to battle against cosmetologists over the use of the pole. The cosmetologists claim that since they too can cut men's hair, they should be allowed to use barber poles outside their businesses. Barbers argue that only those who provide shaves and haircuts should be allowed to use the pole, given their link to the ancient profession. And in South Korea, barbers' poles are used for barbershops and brothels. In some cases, the sign for the brothel spins in the opposite direction as the sign for the barber, or it might contain an image of a long-haired woman, just to make things clear. So, the next time you see a jaunty little red and white striped pole outside a barber's shop, be glad you're just there for a haircut and not an amputation. That's it for this episode. Join me next time for another fascinating look at medicine in history, culture, and the arts.